I like to say out-of-hospital birth and out-of-hospital care is very female-centered. So it's very woman-centered birth and a woman-centered experience. And it's not systems, protocols. I feel safer in my home than I do at a hospital when it comes to having a child. The medicalization of birth can really do a huge, huge detriment. Fertility is a health marker, in my opinion. It's really unfortunate how much of a chokehold insurance companies have on birth choices for most American families. It sucks.
Hey everybody, welcome to the Sovereign Health Podcast. My name is Andy Schoonover, and we're on a mission to inspire radical personal responsibility for both the financial and physical aspects of your health. We get the joy of hosting thought leaders who are reimagining how healthcare is delivered. We're excited to have Emily Stanwyck on the podcast today. She's a mom, wife, birth educator, doula, and all-knowing in prenatal and postpartum holistic care. Emily, welcome to the podcast.
Thank you so much. I'm stoked to be here.
Yeah, we were just talking about before we started. I think you're probably our number one referral source at this point for new CrowdHealth members. Whoop, whoop. Thank you for doing that. It's awesome.
I did not think I'd be slinging health insurance on the internet, but it is such a thing. Like everyone, whenever I've talked about our health share in the past, before we joined CrowdHealth, people were so curious about it. Very hesitant, super curious. So I just shouted it from the rooftops prior to you guys. But, you know, now that you guys have like a social presence, you're more of like kind of a cool like startup vibe than what we previously had, which was
We're a little sassy. We're a little sassy.
I love it so much. That is so me. So I want to support you guys because I really believe in this model of care so much.
Oh, well, thank you for all that you do for us. And I've got just so many questions. I had you on because I told this stat to somebody a few weeks ago, and it's almost unbelievable. And so I'll ask you, and maybe you already know the answer to this because you've been following along with us for a little bit, but what percentage of births every year are home births in the United States? Do you know the answer to that?
It is 1%.
Yeah, it's one. Well, the stat that I had was 1.6%.
I think it became 1.6 post-COVID, actually.
Is that what it is?
Yeah.
And so what percentage of births are home births at CrowdHealth?
Oh, I think John just told me this.
Oh, you might be cheating then. It's like it's almost 50%.
Wow. I mean, I was blown away.
Yeah. And so I tell that stat and people are like, that is crazy town. But I personally went through all of our pregnancies and was like, oh, yep, there's home birth, there's a home birth, there's a home birth. And it's almost 50%. It's a little bit shy of that. Then we have an additional 10% that are birthing centers. And then the remainder are your, I guess, run of the mill.
So
I don't
40%.
know. 40%.
Wow.
It's 40 and change, something like 40 or 45 or something in there. But like,
amazing.
And so I was really wondering, given you are the expert in this, if you could walk us through like, what is the difference between, what is the experience difference between hospital versus birthing center versus a home birth? Can you just kind of touch on like the highlights of those three or the lowlights, depending upon which one you're describing?
Yes. Okay. Fantastic question. So up until the point of birth, the birth center and home birth are identical. And what that looks like, so the prenatal care and the postpartum care when it comes to a birth center and a home birth are pretty much identical and vastly different. I mean, the whole thing is different from a hospital birth, but prenatal care when it comes to out of hospital is a huge part of it is relationship building. So you have your midwife, and your midwife should be someone obviously who you trust and who has experience and has credentials to her name, but someone who you feel safe with, who you're like, yes, I want you in my house. I would feel safe with you there. Or just who you like, what's your first impression? You know, when I met my midwives for my children, when I met them for the first time, I just got such a good vibe from them. I was like, I didn't even need to shop around. I was like, I love you guys. I feel really safe with you. I got a good referral. Let's do it. So from that moment on, your prenatal care is the standard like number of visits as you have with a hospital OBGYN, but the appointments are about an hour long. And in those appointments, it's a lot of getting to know each other. So like I said, relationship building, you want someone who you really trust, because this is not normal, quote unquote. It is normal, but not for modern times. So you really spend a lot of time getting to know them. They really do a lot of emotional check-in. How are you doing? What's going on at home? Like, how is your relationship? What's life like for you? So that they really get a sense of your mental health, your anxieties, your fears, a lot of really just, they go right in for it, like what's going on in your life, so that they feel that you are, I don't even like using this phrase, but like a good candidate, because like your mindset really matters when it comes to choosing to birth this way. That's not to say every woman can't be in the right mindset, but again, it's quote unquote not normal. So they do a lot of check-in with you too. They could do all the blood draws, most of the blood draws. Some birth centers do have ultrasounds, most don't. So if you need an ultrasound, you're going to go somewhere else for that. But it's I like to say, out of hospital birth and out of hospital care is very female centered. So it's very woman centered birth and a woman centered experience. And it's not systems, protocols, dotting the I's, crossing the T's. When you have a traditional OBGYN care, your prenatal appointments are anywhere from, I think the average, there was a study done on this, the average time for an OBGYN appointment is 7 minutes.
Does not shock me.
Right? At all. So you're not getting to know this person who is most likely a man, and whatever you think about that is fine. I personally, that's not what I would choose. Obviously, I would go the midwife route. I want this to be a very woman-centered experience. It's not to say I don't want a man there. I want my husband there.
There's no mid-husband, right? There's a midwife, but there's no such thing as a mid-husband.
Exactly.
Okay,
exactly. Yeah, like women have been birthing with women for eons up until like 1913. And then it was like men in hospitals. Of course, there are female OBGYNs, but it is a very type A mentality, very systems, very protocol, like minimal autonomy, not a lot of wiggle room. You're kind of on their turf. And so a lot of the conversations toward the end of pregnancy when you're in the hospital system are about induction. Oh, we need to check the baby again. Oh, we need to check the baby again and make sure everything's okay. And it's a lot of, I call it the fear-based model of care. Whereas when you are in an out of hospital situation, there might be cause for concern if something comes up, but no one's living in the what if something goes wrong world. Midwives aren't really concerned if you go past 40 weeks or past 41 weeks. There's not a lot of fear-based conversations when it comes to baby's health. If everything's been perfect up until this point, evidence shows that going past 41 weeks is extremely common for first-time moms. And so there's not a lot of like shaming around that. Oh, you don't want to harm your baby, do you? Like you don't want to go past your due date. So it's a much more loving environment. And again, when I say things like that, I don't mean all OBs say those things, but whenever I hear a woman who's afraid to go past her due date, I'm like, wonder if she's in a home or hospital birth. I know exactly what she's doing. So the prenatal care is vastly different. You're getting a lot of TLC, a lot of like motherly love from your midwife, both in and out of a birth center. So when it comes to the birth, I mean, could not be more different. But there are big differences between the home birth and the birth center birth. I love birth center births, but I am a home birth mom, and I will always encourage people to do it at home because you don't have to leave your house. You don't have to get in the car and drive somewhere, which can kind of throw off your mindset and your everything for labor. It could potentially stall labor. A lot of times it doesn't. I would say most of the time it doesn't, but sometimes it does, where you're in this kind of labor land trance. And then it's like, oh, get the bags, got to get in the car, and we got to go. And then you kind of get there and you're a little unsettled and you might take a little while to get back into it. That's really the main difference for me is like, no, I want my midwives to get in the car and come to me. I want them to be in my home on my turf where it's my bed and my shower and my food, all of my stuff, rather than go to a birth center. Because once you're at the birth center, it's no different from being at home. Like there's this birth center I love in San Antonio that I do births at quite a bit. And it is a literal house. I'm like, you're just at their house. Yeah. It's not safe. Like a lot of people have this misconception that a birth center is like a happy medium. And it's just like, I'm like, okay, if that's what it's going to take to convince you to not go in the hospital, sure. I'll be like, yeah, exactly. It's a happy medium. Cause like, don't definitely choose the birth center over a hospital, but it's the exact same thing. You're just not at your house. You're at someone else's place. So there's truly no difference when it comes to the process of birth when you're at a real birth center. Now, there are some hospitals, I think there are very few in the US that have a actual birth center wing of the hospital where there's like not an OR on the floor and there's not an anesthesiologist on the floor and there are bathtubs. And it's like, if you need the drugs or the C-section, you're going to transfer into labor and delivery. But like, that is not a thing really in the US. That would be a happy medium for me. A birth center as they are in the US is exactly like being at home, except you're the one that's got to get in the car, which I just find to be annoying. I would not want to do that.
So what is there any different protocols? I know you said like the hospital-based protocol is fear-based, CYA a little bit, right? And so I remember with my 3 kiddos, we were, doing ultrasounds. I think it was 8 weeks, 10 weeks, 12 weeks, 15 weeks, 20 weeks. And I can't remember beyond there. There's several more beyond there. Like, is the ultrasound play a different role in home and birthing center or not?
Hugely different role.
Okay.
Hugely different role. So like for my first, I did not get an ultrasound until 20 weeks. I waited until the 20-week scan, which I will be doing this time as well. I personally do not think, unless you have no idea when you got pregnant and you get an early ultrasound for like a due date, like they're not necessary in my opinion. Now, a lot of people have anxiety and they want to hear the heartbeat right away and make sure everything's good. I totally get that. I am kind of a weirdo where I'm just like, I'm just going to wait. Now, midwives use a Doppler. And so at your first appointment with midwives, which is at the 12-week, usually how they do it is you'll do a consultation with them around 8 weeks, 6 to 8 weeks, and then you'll book your first appointment for 12 weeks, and they'll use a Doppler to hear the heartbeat at 12 weeks. So in that sense, it's similar, like to get a heartbeat, they do have that, but it's not a visual ultrasound. It is just audio. It's like a teeny tiny mini ultrasound machine to hear the heartbeat. But for a lot of women, they know exactly when they conceive. Like I know exactly when I conceived. I know the first day of my last period. I had both my, I did 2 different calculators. So I did like my first day of my last period and then my conception date. I got the exact same due date for both. And I'm like, cool, I am spot on. So there's no need for me to get a dating ultrasound. And I personally just think less is more when it comes to ultrasounds, and midwives have the exact same approach.
Why is that? So, why is less more? Is it because there's a I don't know, a radiation or something that's coming from those ultrasounds that you think could impact the baby, or is it a different reason?
2 reasons. That is one. Right now, my answer for that is we don't have studies on ultrasound and fetal tissue change, but we know that ultrasound can alter adult human tissue. So we have to assume that it can't be great for them. Now, everyone gets a zillion ultrasounds. Most babies are perfectly fine. But is it necessary? No, when it comes to that, especially in the first trimester, in my opinion. Not to shame anyone, because I know almost everyone does it. And no one really thinks about it. And that's just kind of the weird thing to me. It's like, oh, wait a second. Is that good for the baby? Huh.
No, I think this is a good educational moment, though, right? It's like if We are all, I think, psyoped into thinking like this is just how you do it, right? And what I love having you on is I want to get a different perspective, because I think the majority of the people who are listening to this is like, this is just how the medical, industrial
100%.
complex tells us that we have to do it, right? And so, and I love that a different perspective on it. And I think that you're right. I mean, is there really a need to get that ultrasound before 20 weeks? Other than just a huge desire to see the little baby, right? Like I remember seeing ours at 12 weeks. And it was like, it's a human, like it's, fingers and toes and it's like, oh, there she is, which is great. But can you wait a couple months to the 20-week ultrasound, which I know is a big one. That's the anatomy scan historically. And so it's a good perspective. I think it's an interesting one.
Yeah. So my other and my honestly bigger reason to do fewer ultrasounds, and at least my midwife's reason for fewer ultrasounds, is because they can be used against you and they can cause a lot more stress than good. So when I say that they can be used against you, is like, for anyone listening, if your 20-week scan is perfect, you do not need to get another one. And I say that because, especially if you're in the hospital, they will say, baby's looking a little big. We're going to need to induce you. Mm-hmm. Your baby's huge or your baby's tiny. This year, all I've heard from a number of clients is you're at risk for fetal growth restriction. Your baby's too small, so we need to induce you. And I'm just like, what? Why would you take the baby out?
Yeah.
It's a whole thing. So ultrasounds are non-diagnostic. They are estimations. While they are good, they're not perfect. It is an image that is not perfect. So making women afraid that they're going to have an 11-pound baby is just going to make them want to get more and more ultrasounds and be like, okay, well, we got to make sure it's not like going to be this crazy monster child. And it just is kind of this cycle of more intervention. And for me, for example, at my 20-week scan with both my kids, actually, for my next child, I am not going to get a 20-week scan. I am just going to get placenta location. I'm going to tell my ultrasound tech, you got 3 minutes to find the placenta, make sure it's not covering the cervix, and then I'm out of here. Because I don't want to see the baby. I want to just totally intuit this process, because both my kids had markers for Down syndrome. Both of them had 2 markers for Down syndrome. And then my daughter had 2 markers for Down syndrome, 1 marker for trisomy 18. Now, these markers are just kind of common denominators of these genetic abnormalities, where if you have like the spot on the heart and spot on the brain that both my kids had, that can indicate Down syndrome. It is not a diagnostic tool. Now, we were like, okay, if we have a Down syndrome baby, like that's what we get, like not what we planned for, but we're gonna keep it. And so at my 32-week ultrasound, I did get a second one with my son because I had a low-lying placenta, which most commonly move out of the way. Once your belly grows bigger, the placenta grows away from the cervix. And then we wanted to just check the Down syndrome stuff. And so everything was perfect. At that 32-week ultrasound, everything was perfect. And I was like, okay, good. So with my second, I had my 20-week scan and I was alone because it was during lockdown. And I just wanted to go home and tell my husband everything was perfect. And I had to go home and be like, oh, so this one's got 2 markers for Down syndrome and 1 marker for trisomy 18. And I was just like, God dang. And they're like, you got to come back every 4 weeks. And I was like, okay, I'll call you guys to make an appointment.
I'll call you.
Yeah. And I just left and I never went back because I was like, you know what? I'm not going to give in to that. I know this baby's going to be fine. And if it's not fine, it's not fine. And we'll handle it when it comes up. And I think I'm definitely an outlier where the not constant checking made me feel better. I think most women, the constant checking makes them feel better, which I totally get. But point being, ultrasounds can catch too much because the technology, while it's not perfect, it is really good. And so they see potential indicators that don't mean anything. And then it just subjects you to a zillion more tests if you're like a high anxiety person.
Yeah. Yeah.
So that to me is like a bigger thing.
So how do you feel about genetic testing then? It sounds like
we did not do anything.
You didn't do anything.
No.
So how do you get the markers for trisomy and the markers for, is that something they see in the ultrasound or is that
like a visual, like it was like a black dot on the heart.
Oh, weird.
Oh, whenever we see that thing, every baby who has trisomy 18 has that thing.
Okay.
So it's not like it wasn't a blood. We didn't do any genetic screens for prenatal. And I talk about this when I teach my class. And I'm like, listen, those are also extremely inaccurate. So the prenatal genetic screen is also not diagnostic. So it screens the mother's blood for any genetic abnormality, but it's not a diagnostic tool. So if those came back and they're like, when you test positive, so say in my blood test, I tested positive for trisomy 18, that's like 15% accurate with these blood tests. They're like crazy inaccurate.
So that creates a bunch of fear, a bunch of FUD for nothing, right?
Exactly.
Yeah.
So, and my husband and I had spent the years prior to getting pregnant working with a functional medicine doctor and really like dialing in our health. And my dad is a carrier for Tay-Sachs, which is like a really horrible neurodegenerative disease in the Jewish community. My husband's father is also Jewish, so he got tested to see if he was a carrier for Tay-Sachs before we even got pregnant. And he's not. So we're like, okay, we're good on that. We don't need to, I'm not worried about anything else pretty much. So we did a lot of like preconception work as well.
Yeah, I want to get back to that because I think that's super important. But one more quick question on this ultrasound. So what about the baby being breech? Does that matter? How can you tell? I'm a guy, if that's not obvious. So I don't know all this stuff. I do have 3 girls. So I saw my wife go through it. But how do you know if the baby is breech? What do you do in that situation? Do you use an ultrasound in that situation? Tell me about that scenario.
Great question. I'm the oldest of 3 girls, so that's awesome. Okay, so midwives are trained in palpating bellies. So they once the baby is closer to the 3rd trimester, between like 25 and 28 weeks, they can really start feeling body parts. And if you have an awesome midwife like I did, she'll like took my hand, put it on my belly and was like, do you feel that? See that squishiness right on the top of your belly? That's the butt. Now feel this down the side. That's the back. Okay, the baby's head down, perfect position because.
Okay, so they know just by feeling that the baby is in the. Is it by kicking too? Can you tell like where the baby is kicking, or does it does that not change?
It's like I think the mom can tell more than the midwives. Midwives are really feeling. It's like they're feeling for a hard mass in your belly, and if they find a hard mass, they're like, okay, that's the head. Baby's not head down. Now, if you're like in the 3rd trimester and they're like, I want an ultrasound confirmation because I can't really tell anymore, that could happen. And in that case, I would say that's a good like medical reason to get an ultrasound is to check baby's position because breech birth is a dying art. And Texas is a great state for midwives. This is one of the freest states for midwives, which is fantastic. Although there are some regulations that I think are totally asinine that we need to call Greg Abbott about, but very free state. So midwives here are allowed to catch breech babies. I hate even saying that because it just makes it so like a legal thing. But like California, where I came from, it is illegal for midwives to catch breech babies and twins outside of the hospital when they're like the only people who are trained in that. They don't teach breech vaginal delivery in medical school anymore. They just do cesarean, which is criminal in my opinion. So breech vaginal delivery is a skill that many midwives learn. And a lot of them take, what do we call it? Like CEUs, like classes outside of their traditional school to get better trained in breech. But yeah, so most midwives can palpate and feel, but then they might want an ultrasound confirmation just to be 100% sure. And then again, in that case, I would probably be like, okay, cool. But if I had a midwife who was like, I think your baby's breech, I'm 98% sure, I'm comfortable with a breech baby, I probably would be like, okay, cool. If you're cool with that, I don't need an ultrasound. But if it made them nervous and they wanted to check and confirm, like, then that would be an instance where I'd be like,
what is it then with the medical community that has such a problem with breech? Like, what are the risks there, or is it just a bunch of fear?
I would say the risks are marginal, but it is a variation of normal. We should tag Dr. Stuart Fishbein in the show notes because he is a phenomenal resource. I'll write it in the chat here. I'm actually his virtual assistant, so I know a lot about breech.
There you go.
Birthing Instincts is his podcast and his Instagram, and he is an OBGYN who left the hospital system decades ago, maybe over 20 years ago, to assist midwives in home breech and twin births in California. Because you can have a home birth with a breech or twin babies, breech baby or twins, when an OBGYN is present. So that's what he does. And it's really fantastic. So the risks, I think, 2 feet, like feet first babies, I think are more higher risk than a butt down baby because like one leg could like kind of miss the hole and get caught. I think that the foot down babies are more of a high risk. Getting the head out is more of a risk because instead of coming out crowning, you have to kind of like tuck the chin to get the head out. And it's just a skill. But I've watched breech free birth videos where there's no midwife present and the baby just comes out. So like when it comes to the risks of breech, I'm just like, but how did we get here? Breech babies were born before the skill of breech delivery was taught. It was just, we see a butt, not a head. Okay, come on, just less common. I think just like the manual delivery of a breech is just different. I don't know if it's like more risky. I think it's just different. And a lot of providers just aren't taught it. So it makes it more high risk because they don't know how to do it.
Yeah.
I think that's the risk. They don't know how to do it.
I'm wondering if some of the fear here, if you have a crown first birth and there is some kind of risk that goes wrong. I don't know what it is. Maybe it's 1 in 10,000 or something like that. I don't know what the risk is. And if breech is, or home birth or whatever is 2 in 10,000, people will use a stat that says, well, it is twice as much, twice as risky, And it's like, well, yeah, maybe that's the math, but it's 1 in 10,000 versus 2 in 10,000. I don't know what the stats are. I'm just kind of using that as an example, but we get that wacky math all the time. But there is, I think, as I've talked to people about CrowdHealth and these home births, which is again just a wacky stat. I mean, it's a cool stat, but it's a wacky one. Yeah, people are like, oh my gosh, I would never do home births. Like, there is such a fear here. I'm sure you've heard it. What is the source of that? Is it reality? Is it fiction? Let's get to the bottom of, whether home births are significantly more risky than going into the hospital to have your baby.
Hell yeah. Okay. I would ask the woman who said that, do you know how many babies die at hospitals? And I started to get morbid right away. But that's the fear, right? Is your baby's going to die. And
no, it's true. That's the bottom line fear. Yeah.
That is the bottom line fear. And I don't like using such blunt words when I'm speaking to pregnant women, but since we're having a podcast, be real, 99% of women, okay, so 98 point whatever % of women birth in hospitals in America. We have one of the highest mortality rates for women. And I don't know what the mortality rate for baby is. But we have third world.
It's one of the highest also.
Yeah. Yeah. We have terrible mortality rates for women and babies. Where is that happening? It's happening in the hospital. Okay. So I would just automatically be like, okay, I understand your fear, but it's that's because we don't talk about the terrible things that go on in hospitals. I mean, I heard this horrific story of this woman who everything went perfectly and they gave her an epidural and they pumped it up way too high. She couldn't feel anything. I mean, she was numb. And she was saying something like something feels off and weird. And no one was paying attention until finally the baby's heart rate monitor wasn't picking up the heartbeat anymore. And her baby passed away because the baby was born and it suffocated in the bed because she couldn't feel it come out.
Oh, wow.
So it was born without her knowing it and was like face down on the blankets. Anyway, sorry to share a horrific story, but that's the reality of hospital births sometimes when things go wrong. It's like the medicalization of birth can really do a huge, huge detriment. So when it comes to home birth safety, I have an actual study that if you remind me, I'll share in the notes with you too. And I just do want to preface this. When you're someone like me who has a grasp on the reality that with birth comes death, and, you know, as a parent, you worry, you can't spend your whole day worrying about your child's life, right? Because you'll go insane. You'll want to helicopter parent them like crazy and never let them leave your sight. It's just not real life. So you have to kind of give in to the reality that they're going to take risks and they're going to make mistakes and, you know, stuff happens and I'm going to do my best. And things happen at home births. Of course they do. Of course they do. And it's terrible and it's devastating, but things happen at hospital births too that are terrible and devastating. And, you know, and then the devil's advocate from the hospital birth side is like, but the hospital saved my baby's life. Well, and to that I say, well, thank God you were there. You know, I'm just like, you had this intuitive choice that you made to be in the hospital because you were scared of something going wrong, and it did, and it saved your baby's life. Thank God you were there, you know?
Yeah.
That's what I always say. I'm not like, well, you know, you're an outlier. I'm just like, no, you made the right choice for your baby and your family. And thank God you did. Like I had a friend who had a home birth plan and then she transferred and it was devastated about it because that was not their plan. And she had a postpartum hemorrhage and nearly died, the mom. Yeah. And she was like, thank God I was at the hospital. I would have died if I was at home. And I'm like, dude, like, I just like, God knew, you know, your body knew, your intuition knew. It was just like, everyone's got to make a choice that feels the safest for them. Safety is not real. It's a made up thing. It is a sense of how you feel. I feel safer in my home than I do at a hospital when it comes to having a child. If my midwife says we need to transfer because something's wrong, I'm going to be like, great, let's go right now. You know, I'm going to listen to that. I believe in Western med when it comes to life-saving care, 100%. But like, sure, you know, statistics on where we're at when it comes to medical malpractice and death in America. It's not insignificant, right?
Right.
We have to work that in to maternity as well and postpartum care. So there was a study that was done that came out in 2021, so pretty recently, that followed 17,000 home births, which is really cool. Like that's a pretty big number. And I'm going to try and do this from memory. Either 87 or 89% completed at home. I believe it was 89. Yeah, 89% successful home birth. That is huge. Of the 11% that transferred, there was 7% C-section rate. So like of that study, 93% were vaginal delivery. So there was 4% that were vaginal delivery in hospital, 89% vaginal delivery at home, and then 7% C-section rate. And while I don't agree with most things that the WHO says, they do say that like a healthy first world maternity C-section rate is below 10%. That is like medically necessary cesarean. So for that whole study, the C-section rate was 7%. And that is just fantastic. And most midwives have a C-section rate of under 10%, if not under 5%, which is just phenomenal. And that has a lot to do with the prenatal care, mental health assessment, emotional well-being, physical health, fitness. Like they talk about nutrition. I didn't mention that in the prenatal, but like a lot of nutrition talk, a lot of like talking about your fitness and really helping you tackle your health and pregnancy from a holistic standpoint rather than, oh, you got high blood pressure, let's just get this baby out. It's like, no, we can manage that with food and like supplements and stuff like that. So on the other hand, or on the other side of things, we have in hospital nearing a 35% C-section rate right now, which is like really horrible.
Significantly
Like really
higher than anywhere else on the planet.
first world. Yeah. Like we're like Brazil status with our C-sections. Like it's crazy.
Mm-hmm.
And it's really,
And it's primarily out of fear again, right? It's out of fear that something little is not perfect. And so, okay, let's just take the baby out.
yeah. And a lot of, I don't know the percentages, but when you have like a cocktail of meds in your body, it can cause fetal distress. So baby's heart rate drops and stays down. And usually that's a combination of Pitocin and epidural. Because in an epidural, they use fentanyl. So you have a narcotic and then this contraction drug, and it can cause fetal distress. And then if they turn the Pitocin off, and your labor doesn't progress naturally, they're like, we got to get this baby out because like you can't go home, and the Pitocin is causing harm to your baby. So like, we just got to get this baby out.
Right.
They'll call it an emergency C-section. It's not a true emergency when it's just fetal distress. And it sounds bad, but it really just means like a dip in baby's heart rate, baby's not recovering well. Everything's okay once we turn the Pitocin off. Mm-hmm. But when we turn the Pitocin off, contractions stop. So we got to get baby out.
Right.
I have to imagine that is a large part of our C-section rate. And then a lot of it is repeat C-sections. A lot of it is elective C-sections, which I'm not against. I'm always just like, I'm woman's choice. If you want a C-section because of trauma or whatever, go for it. That's your choice. Yeah. But it is crazy high.
Yeah. Well, I think we probably skipped the prenatal stuff faster than I should have, because I am interested. It does remind me, some of the things you talked about in terms of maternal mortality, fetal mortality, and a lot of that from the work that I've done, and it's been, brief, but a lot of that has to do with obesity. And so, my question for you is like, is there a, what are the characteristics that you're looking for in a mom that lead you to say this is a good opportunity for you or not a good opportunity for you? You mentioned earlier kind of the mental component. Like, is this really what you want to do? Like, are you mentally, fired up for this? Is there a physical component here too? Are there other physical things we should think about in the prenatal side that you think are important?
Great question. Now, I do want to preface my answer by saying, if you can get pregnant naturally, that is a marker of health. Mm-hmm. So if you are obese and you can get pregnant naturally, that is a marker of health. Fertility is a health marker, in my opinion. Mm-hmm. So I think a woman can give birth at any size, and I am not a proponent of health at any size. Mm-hmm. But you can give birth at any size. I do want to make that slight distinction. Do I think being obese is healthy in any way, shape, or form? Absolutely not. Is it a result of poor habits over time or trauma or tons of different things? Yes. To me, when it comes to like having a healthy pregnancy and birth, I don't focus on weight loss with women, because that can really mess with their head. Mm-hmm. Like, I have a friend and she's like, my OB keeps telling me I'm obese. I said, Meredith, you got pregnant. She should be focusing on how your fertility is in good health. And let's just support your body right now. Mm-hmm. Like, I don't want to focus on you losing weight in pregnancy, because that is really counterproductive. Let's mm-hmm. focus on supporting your and your baby's growing body. If you lose weight in the process, I'm okay with that, but that's not my focal point. For me, it's more about major habit change. So hopefully this starts in preconception, but a lot of times getting pregnant is really the kicker for people. And they're like, oh God, like now I'm pregnant and I wish I didn't feel like this, or I wish I could move better. I'm like, I try and just really meet people where they're at. Mm-hmm. Because I don't want to shame anyone for being fat, because that's not really helpful. Even though I think it's like the worst thing that you could do to your body besides like chronic alcohol and drug use. It is really important to just really help people shift their mindset when it comes to lifestyle changes.
Mm-hmm.
Midwives do a great job with that. But when it comes to obesity, that can negatively affect your birth. It can not.
Mm-hmm.
Plenty of obese women have home births, but their blood pressure is good, their glucose is good, and they're living as best as they can, healthy daily life. I mean, I'm guilty of getting in and out during pregnancy. Like, I'm not going to tell someone like, don't eat fries when you're pregnant, because like, that's just mean. In your first trimester, you might just be like, that's all I can eat right now. I'm just like, let's just try our best every day. And if you didn't do your best today, that's okay. Let's try your best tomorrow. For me, it's really like daily habits. But do people who have high blood pressure, are a lot of them obese? Yes. Like, a lot of them. Are a lot of obese people gestational diabetes, more at risk for gestational diabetes? Yes. Both of those things are very manageable with diet and lifestyle. Mm-hmm. So like a high protein diet, lots of electrolytes, movement every day, even if that's just 10 minutes of walking, you just have to want it. And I think this is where I'll shame people. We live in a pretty lazy society, right?
Yes.
I don't care if you're fat, if you're trying and you're doing your best, I'm proud of you. I am stoked for you. If you didn't lose any weight in your pregnancy, but you're trying, oh my gosh, you're doing amazing, right? It's the women and people really. And again, like, I don't want to be shaming, because again, it's just conditioning. Like, we live in a world where you press a button and your stuff comes to your door. Mm-hmm. We don't have this hard work mentality. A lot of our country does not have a hard work mentality when it comes to physical bodies and nutrition. It's very convenience is everything. And that complacency will be more of a detriment to your birth, because you're just going to be like, oh, my doctor says I'm fine. My blood pressure's a little high, but like, whatever. And you get to the hospital and your blood pressure spikes like crazy in labor because of all the drugs. And then it can be an emergency.
Right.
That's when we get into like the malpractice or the postpartum hemorrhage or bleeding out. Like, gnarly things happen when you don't take care of your health. Mm-hmm. So it's a really interesting fine line of like, obese people are unhealthy. Yes. And obese people can have a perfectly healthy pregnancy and birth.
Mm-hmm. Mm-hmm.
Yeah.
Right. No, that makes total sense. The kind of other interesting component of this that I'd like to end on is, CrowdHealth is kind of an alternative to health insurance. We think health insurance is terrible. We think it's evil in many ways. CrowdHealth is not a health share. It's different than a health share. We do things totally differently. But
what should I call it? Not a health share.
Well, we call it healthcare crowdfunding, because we're actually going out to people in the community and say, hey, will you help this person with their pregnancy? And then that person has an option. They can or they can't. It's up to you. Health shares typically are you have to, and if you're not, you're out. And ours is peer to peer. So Emily, as I think you just announced, is pregnant, right? Is that announced or not announced?
No, we're announcing it, because when this comes out, I will have announced.
Okay,
hopefully.
You are pregnant, and so you can submit those bills to the community and say, a woman in Texas is pregnant. Will you help them? And so then it's a peer-to-peer transaction. CrowdHealth doesn't get in the middle of that. We just hook you guys up so that the people who need help and the people who are willing to give help are connected, which is how it's been done for hundreds of years. Just we're doing it with some technology. But does health insurance, the legacy health insurance that we're trying to break people free of, does that pay? What is the difference of having a home birth at home versus with a CrowdHealth? Are there limitations? I guess saying it a different way, are there limitations to what you can do with health insurance? They don't pay for things like that?
Yes, definitely. We had Liberty Health Share and United Healthcare with our first. We had United Healthcare through my husband's work, and then we paid for ourselves to have Liberty. We're basically like, okay, whatever United doesn't cover for our home birth, we'll try and get covered through Liberty. And because we joined United because they said they covered home birth. And it was a whole nightmare. They didn't cover anything because we didn't read the fine print, which we didn't see anywhere, which was that you're not allowed to get pregnant within the first 90 days of being a client. And I was just like, so you're telling me we have to like plan our family? Like, to some degree, you want to be a member before you get pregnant, like CrowdHealth does. I totally get that.
Yeah.
Like, we got pregnant like 4 weeks after we joined, or 5. And I was just like, perfect, you know? So United didn't cover anything. And by the time we had finally settled everything with United, like over a year had passed. So Liberty didn't cover anything because it had been, dude, it was a nightmare. So some insurance companies will cover midwifery, but they're not going to cover the full amount in any way. They're going to do the same thing that they do with a hospital. So the hospital's going to bill $50,000 for your birth. They're going to, cover a portion of that. Your out of pocket's going to be potentially still more than you might pay for a midwife. Like, that's the thing that I hated about hospitals is you don't know the cost until you get the bill.
Yeah.
Obviously, I know you.
I'm dealing with that right now.
Total disaster. So some insurance companies cover birth centers, not home births, because they're like a licensed place. I get that. But by and large, insurance companies have a chokehold on Americans. And I think that's why our home birth rate is so low, is because financially it is a huge out-of-pocket cost for most people. Like, my midwife charges, I think her upper end cost, which is where she goes to your house for all her prenatals instead of you going to her office, is $8,000. Like, that's a lot of money.
Yeah.
I think she charges $6,500, which is pretty standard in Texas right now. Between $5,000 and $7,000 is normal, where we're at. And a lot of people can't afford that. And they think that, or maybe they have excellent coverage through their work, or they're on Medicare or whatever, and they're going to have no cost. And that's really amazing. But to me, I'm like, but there's still a cost. Like, you're potentially subjecting yourself to like a total shit show of intervention that you may not want. So it's such a detriment. I hate the insurance system because there's change does not happen quickly with those companies. And so they're not going to want to cover home birth and a birth center birth because they're not going to make a ton of money on it, because their midwives are charging $6,000 instead of $39,000, right? Yeah. Like, it's very frustrating. So I get why people choose hospital birth, because it's less of a cost. But then you have the alternative where if something goes wrong and say your baby needs to go to the NICU, like someone messaged, I posted on my Instagram, how much was your hospital out of pocket cost? Most of them were between $5,000 and $10,000. So $5,000 is a little bit less than what you're going to pay for most midwives. $10,000 is way more than you're going to pay for most midwives. At NICU, my friend, she was like, mine was like $100,000 because both my kids were born so early and they had to be in the NICU for months. I was like, what?
Yeah, NICU is going to be a minimum of 100, and they're typically closer to $1 million.
It's insane.
Yeah.
And it's just so criminal. So you just...
Through the insurance, I should say. Through insurance, that's typically what it is.
So for me, I'm like, I'm always going to bet on midwives because, like that study showed, we have an 89% chance of having a successful home birth. To me, that is well worth it. So I'm going to bet on midwives, plan financially. Most midwives are really wonderful when it comes to payment plans. I'm going to bet on a midwife every single time. I know my exact cost. And if you're lucky and you sign up for CrowdHealth before you get pregnant, you're only paying $1,500.
Yeah.
Right? Which is phenomenal. And it's like,
it's going to be a little bit more than that next year. But if you are pregnant now, it's $1,500. It's going to go up just a little bit. But there's...
Either way, like, that is very doable for a lot of families.
Yeah. Yeah.
So it's really unfortunate how much of a chokehold insurance companies have on birth choices for most American families. It
Yeah.
sucks.
Well, if people are trying, if they're pregnant or they're trying to get pregnant and they're trying to decide, which direction to go, where would you point them?
Great question. I do consultations. So I love having this conversation with people, like what's right for me. Or a lot of times it is the husbands who are more nervous,
Mm-hmm.
which I totally understand because they're like the everything has to be safe and perfect and okay. And I want to control and manage.
There's a
the entire.
protector component of this.
Absolutely. Oh yeah, 100%. So usually it's not convincing anybody. It's just sharing my experience, sharing those statistics from that study, really talking about, you think about hospital births are a relatively new thing. Your whole family bloodline up until 100 years ago was born at home without a
Yeah.
doctor.
Mm-hmm.
And I try and tell that to all the women I work with. I'm like, it is in your bloodline. It is in your family. This is in you. You have the capability to do this. Like 100 years is all we've had for hospital births, but it flipped overnight to
Mm-hmm.
where this was the new normal. And if you just think, man, how'd we get here? We got here because of home birth. And so it's really just rooting people in that, making them feel like, wait, what is there to be scared of? So I love having those conversations with people. I would also recommend doing consultations with midwives, finding someone who you feel comfortable with, who you feel safe with, and who has tons of experience. So you can ask them all your fear-based questions and they're going to be like, this, that, they're going to answer them very
Sure.
honestly, very open. And you might leave feeling like, that was awesome. Like, I love her and I totally get why you want to do this. Most men are like that. And then when most men witness home birth, like my husband can't shut up about it now because it just thinks it's just so amazing. He's like, it was so awesome. You're just at your own house and they leave and you just go to bed. It's amazing. Like that was his favorite part. You don't have to go anywhere. We've got our fridge right here. This is so nice. And your baby
You're not
is
sleeping on that hospital couch that nobody.
Oh, gosh. Terrible thing. Yeah. So really just ask questions to people who've done it before, or me, or find a midwife in your area who you can consult with, even if you're not pregnant yet. If you're preconception and you say, send them an email and say, hey, like, I really want to get pregnant in the next 6 months. And I really want my husband to be on board with home birth. Can we meet with you next month? So we can like be on the same page by the time I'm pregnant. That's a fantastic idea.
Yeah, I love that. Okay, so reach out to you because you'll do consultations. Yeah. Where do they reach you? Where can they find you?
Yes, my website is emilystanwyck.com and there's like a work with me tab and you'll see consultations there. Instagram also. My Instagram, if you send me a DM and you want to
love it,
schedule a consult that way, that's chill also.
Second way you said was reach out to some midwives and do some consultations with midwives. What if I'm reaching out to a midwife? You're the expert here. What are the 3 questions I'm asking, or what are the top 3 questions that I'm asking a midwife to figure out, like, is this person legit or not?
Okay. I would ask them how many births they take a month.
Mm-hmm.
Depending on how many midwives are on staff. So my midwives, there were 2 of them and they took 4 births a month between the 2 of them. And I felt very good with that.
Okay.
Like no one was going to be late to my birth.
Is 4 the magic number?
No. Just whatever. Like, so they explain like, there's really no way of any overlap. Like one of us will absolutely be there type of thing.
Okay.
And there's a birth center here that has like 7 midwives on staff and they take like 16 births a month. But again, that's okay because there's really no way they're going to miss it. I would ask them their C-section rate because that I think is really important.
Okay.
I would
and what is the C-section rate that is too high? So if they come back and they said, my C-section rate is X, where do you start getting a little nervous?
I start getting a little nervous over 10%.
Okay.
But definitely over 15%.
Got it.
If it's between 10 and 15, I'd be like, why is it that high? Tell me more. I would ask them their transfer rate. So what's your percentage of transfers? And I don't really have a statistic that would make me feel good, except I know that like less than 20% is where I'd want to be.
Okay.
If I had like 25% or more transfer rate, I'd be like, no, something is clearly wrong.
Cool.
And then finally, the fourth question I would ask.
Oh, you took 4 instead of 3, but I'll give you 4. All right.
Okay. My fourth question is ask them the question that makes you the most scared.
Okay.
It's different for everybody. So if there's something that really freaks you out about home birth, like what's your infant mortality rate? Have you ever had a fetal demise at a birth? Like you could ask them the hard questions that make you nervous, and they will openly answer them.
Okay, so let me think if I can remember these. How many do you take a month?
Yeah.
What is your transfer rate? What is your cesarean section rate? And ask them the question that you're most fearful of. Those are the big 4 questions you need to be asking. Definitely. I love it. Go to Emily's Instagram. It's pretty hilarious. I love it. You'll get a laugh. You'll learn a lot. Emily, thank you for taking some time with us. I appreciate it.
Thank you so much.
I feel a lot more educated as a guy about this home birth thing. I feel more comfortable with it thanks to you. And go to Emily's and it's emilystanwyck.com. It's STANWYCK.com. And don't miss it.
Handle is just
love it. Thanks, Emily.
Thank you so much.
Yeah, we'll talk to you soon.